Hey everybody, we're back with another heart. This is number 882 in our collection. And let's start off by looking at the phenotypic features of this heart. A little teaser or sneak peek, so to speak. So we'll go to the posterior aspect of this heart first. And here we find the left atrium. And we can see the pulmonary veins draining into this left atrium. We see that the oval fossa here is intact. There's no atrial septal defect. And we quickly note that there is no connection between the left atrium and this very hypoplastic left ventricle here. So, mitral atresia, although there is this interesting little dimple at the floor of the left atrium, which we'll explore in a little bit. Once again, there's a very hypoplastic left ventricle here, and there appears to be a small ventricular septal defect. So let's quickly go over to the right ventricle and take a look. And when we look at this right ventricle, which is of good size, there does appear to be this anterior muscular ventricular septal defect here, which goes into the left ventricle. So it looks like we're dealing with a functionally univentricular heart with an intact atrial septum, mitral atresia, and aortic atresia as well. But now, let's go ahead and set the heart as it would have been in the chest, and then go through all the details. And the heart would have sat roughly in the chest like this, anterior surface towards the screen, posterior surface towards the turntable, head or superior here, legs are inferior here, left over here, right over here. Let's start off as we usually like to, which is by trying to identify what is, at least externally, the right atrial appendage. And here we find an appendage that's triangular, broad-based, or pyramidal in shape. And we also see what appears to be the superior caval vein with the brachiocephalic vein still attached. So let's go ahead and open up this atrium. And when we do that, we find that there are pectinate muscles that spill outside the confines of the appendage, consistent with a morphologic right atrium. We see that the oval fossa is in fact intact. There is no oval fossa interatrial communication. Here is the tendon of Totaro. And I can't actually, and here is the mouth of the coronary sinus, hidden behind the Thebesian valve here. So mouth of the coronary sinus, Thebesian valve, and then the tendon of Totaro here. Right. And here's the superior caval vein. And we can see that connecting into the roof of the right atrium. And just to demonstrate how that drains into the roof of the right atrium, here is the mouth of the superior caval vein into the right atrium. And the last structure we'll talk about in the right atrium is the triangle of Koch. And remember, that will be bounded by the mouth of the coronary sinus, the tendon of Totaro, and the tricuspid valve. So here is the triangle of Koch. And at the apex of the triangle of Koch is where we expect to find the AV node, or the atrioventricular node. So in this heart, we would expect the atrioventricular node to be here. Then we come across a right-sided atrioventricular valve with 3 leaflets, 1, 2, 3. There are direct connections of the septal leaflet to the ventricular septum itself, all consistent with the morphologic tricuspid valve. When we look at this ventricle, there are coarse trabeculations. There is a septomarginal trabeculation, all consistent with the morphologic right ventricle. Now let's take a look at the outflow portion of this right ventricle. And as we open this up, we actually find that there appears to be a ventricular septal defect, which is actually anterior to the septomarginal trabeculation. And it does go through to the left ventricle. So there is an anterior muscular ventricular septal defect. You can see that it's surrounded entirely by muscle. And then as we come to the outflow tract here, we do find an arterial valve with 3 leaflets, 1, 2, 3, with 3 sinuses, 1, 2, and then there's a third sinus here that's been somewhat transected. We don't see any coronary arteries arising from any of these sinuses, and we see that this gives rise to the pulmonary trunk. So this is in fact the pulmonary valve. And as usual, the pulmonary valve is entirely supported by muscle. Note that there isn't really any true round or oval structure here that would be consistent with what we refer to as the annulus. The valvar structure kind of has this crown shape or semi-lunar appearance. And here are the fibrous valvar leaflets of the pulmonary valve. Here is the pulmonary trunk. And then why don't we go to the posterior aspect of this heart now. So now here is the left atrium. Let's get that nice and exposed here. So here is the left atrium. We can see pulmonary veins draining back into the corners of the left atrium here. Here is the left atrial appendage with all of its pectinate muscles confined within the appendage itself. And here's the mouth of the left atrial appendage into the left atrium. Once again, we see that the atrial septum is intact. There is no intra-atrial communication. And we see that there really isn't any connection between the left atrium and what appears to be the left ventricle here. So there is mitral atresia, although interestingly, there is a dimple here in the floor of the left atrium, although it is not patent and does not lead anywhere. So there is a little dimple here, but it isn't patent. So mitral atresia. Now, when we open up this heart here, we do find what appears to be a left ventricular cavity, although it is quite hypoplastic. And interestingly enough, we do find what appears to have been a left atrioventricular valve here. You can see a leaflet here, and there are cords here, and it does appear that this valve would have had 2 leaflets, one here and second back here. So this may have been what wanted to be a mitral valve, but didn't quite form properly, but there is a second AV valve here. But there is no connection between the left atrium to the left ventricle through this valve. Once again, a very small, very hypoplastic left ventricle. Here's another view at that very interesting mitral valve. If you have any insights or comments about this mitral valve, please leave them in the comments. And as we look at the ventricular septum here, we do find that VSD that we had seen before. Remember, this is an anterior muscular ventricular septal defect. And we don't see a real outflow to this left ventricle. So there is mitral atresia and aortic atresia. Although there is a mitral valve here, at least leaflets of it, but no connections to the left atrium with that valve. And we can actually try to open up this atrium down here as well to confirm that we can't find any sort of communication with that mitral valve. So, an interesting heart with a very small left ventricle, a mitral valve that's present but imperforate, so no connection between the left atrium and the left ventricle, an intact atrial septum, but otherwise normal right-sided structures. So a functionally univentricular heart with mitral atresia and aortic atresia as well.